So, hi everybody, this is Adriel William, and today I have the opportunity to finally talk to Dr. Ikra Bora. And just to give you a brief interview, she is one of the very few international dentists I came across who have the privilege, or I would say honor, to get into three different opportunities. So, first of all, she was working as a dentist on a limited license in Massachusetts. After that, she got into DDS program in Oklahoma and Howard University. And thirdly, she also got accepted to AEGD program with NYU Langone, and she originally did her DDS from Saudi Arab. And let's talk to her about her experience and how she was able to get all of these opportunities, which is very, very rare. As far as I'm concerned, and I've known people, somebody to get into all of these three things is very difficult. And currently, she's doing her DDS at Howard University in DC. So, thank you for joining us, Dr. Ikra.
Thank you for having me here.
So let me ask you. So the way you were in the Facebook groups and you helped me out when I was applying for
Mm.
processes, and from your experiences, can you tell me a little bit about your past education? Where did you do your DDS and about your exposure, your clinical exposure before coming to US? How was it?
Yeah, so my dental school was in Saudi Arabia. So I think that was one of the benefit. It was very long. It was 6 years of the schooling with 1 year of internship. It was a very clinically oriented program. So I would say that we did a lot of clinics, and it was much like the US. We had the GPA system, we had clinics, we had didactics, everything was all together all the time. There was nothing like a month of perio, was always there. So it was very
Okay,
similar to the US, I would say.
okay. And what about the electronic parts? Like, did you guys had Axiom or software? Like, was it electronic out there, or did
No,
you do
no, no,
charting
no.
on paper?
That was charting. That was paper charting, no electronics. Yeah,
Okay,
this
so
was,
you pretty much studied like for 6 years of dentistry. I know a lot of Middle Eastern school in Egypt and other places, their DDS is of 6 years, right? And then
mhm,
you did 1 year of house job.
yeah.
So, how many years were didactic, and how many years was the clinical exposure out of that 6 years?
So we started clinic in the third year. So the first 2 years were mostly didactic. But
Right.
as soon as the semester of the third year started, the first semester, it became clinical. So
Okay. So pretty much you can say 4 years approximately.
yeah,
That's quite a lot of time. 5 years, somebody. So what about your exposure when you came to US? How was it, and what did you do? How did you? Let's talk about your journey when you landed to US and how it worked for you.
yeah. So like everyone, of course, I did the part one and part two NBDAs, and then I moved on to doing TOEFL. And after that, people tell you you cannot work here. You have to go back to school and stuff like that. So I was in the middle of everything. I was searching my way to work at the same time I was also flying. I did assisting with endodontist in Texas, and I worked for him for some time as an assistant. And at the same time, I was trying to get research experience because there are three things like research, volunteer, and assisting, right? So you're trying to get the most of everything.
So where did you do your research?
My most of my research was back in Saudi Arabia. I already had two publications when I got here. So my research basically was in Saudi Arabia, but here I was just trying to go to schools. I did go to University of Houston and University of Texas in Houston for some time to try to get some research experience, and that was a good one. I did a lot of externship in that time, whatever externships I could get in Tufts in San Antonio, in different in general dentistries and AGD programs. an OMFS program, an endo program, just to get an overall idea of what a US school is like.
So my question is, so you said you were volunteering or look or doing dental assistantship in uh, Texas. So
Mm.
how did you landed up doing dental assistantship in Texas to all the way to Massachusetts and getting a limited license to practice? Because that's very rare for a foreign trade dentist. Comparatively, it's rare to get that opportunity to work as a dentist under in a community health center without a DDS in US.
Yeah, so you just have to really believe in yourself and look for opportunities that are out there. Even though I was in Texas, I was looking everywhere. I didn't care where it was in the US, but I was looking for clinical experience because I thought that my profile was lacking some clinical experience. I had research, I had publications, I had volunteering, I had everything else. So I wanted to work clinically as a dentist. So that's what when I looked for it, you will always find what you look for. So
So how did you so did you email them or did you went in person to the community health centers or what was the process?
no, so the process of getting a job there is just to apply for a job, really. So I looked, and I think when I first applied there, I applied from Saudi Arabia because I was visiting Saudi Arabia. Um, and I applied from there to several health centers in Massachusetts once I figured that that was a possibility. Then, when I applied to several one of them, two or three of them got back to me. I had my interviews, and then one of them offered me the job.
So when you started work, did they look into your clinical experience from back home, like how much clinical stuff that does that matter?
Um, I do not know a lot of people who have done the same thing as me, but I do know a few of them, and I think it's how you present yourself. So even though you have as much or as little, if you are confident and you do good in the interviews, I think that matters more because I've seen people who had like 20 years of experience and they still didn't do well in those jobs. So,
So when you were working as a dentist on a limited license on a
mhm.
community health center in Massachusetts, didn't you feel like this is enough? I don't need a DDS. I'm good enough. I'm working as a dentist. I'm making money. Why go through the school and the loan and everything?
I know that's the feeling. And I guess at one point I did feel that way. That's why I stayed there for almost 2 years. But after some time, you realize that you want freedom more than anything, and you want the ability to move anywhere. So that's why I eventually decided to go back to school.
So then as you told me, you applied for AGD program and you got accepted into that
Mhm.
residency, which is AGD is Advanced Education in General Dentistry. And mostly people go into that after DDS. So you got into it right without even DDS. So
Mhm.
why the DDS over AGD for you?
So it was that's a good question, but I think that really mm, depends from person to person in the sense that you really have to look where you live, where your family is, and if it's a state like like Ohio or something, if it accepts AGD to be full licensed or something, then you're better off doing that. But that was not my case. I was from a state like Texas, which is not giving license to AGD, and the rules are constantly changing. So I just didn't want to be in that roller coaster.
Yes, so when I was living in, just to summarize for the viewers, so if there are certain states which allow you to get license if you have done AGD, for example,
Mm.
Virginia, Ohio, Washington, and a couple of others like
Illinois.
six, seven states. But most of the states require a DDS for you to get a license. So when you were applying to the AGD program at NYU Langone, what factors do you think were the most beneficial for you?
Um, Factors were more beneficial for me.
Yeah,
I
for in your application.
I believe the fact that I was already working, but that was the COVID times, and if you remember, Adriel, I never really applied to the program until post match, and it was after the post match that I was like, okay, there is an open seat, I'll give it a shot. But
Okay.
it was more like, I guess maybe because I was already working, but then I've heard a lot of people have never worked in North and are fresh graduates. So I think it's very diverse as to what they're looking for. Every program is different.
So if somebody is applying to an AGD program, what would you suggest them to focus on in their application? What would be the one thing that you would say as compared to DDS?
Yeah, clinicals, clinical part, and really show your skill, really show that you know what you're doing.
Okay. And one factor when I was applying to schools, for the viewers, when I was applying to different schools, and so she guided me on the Facebook groups regarding this whenever I had questions. So I'm going to ask you, when you were applying, and and you got accepted to Oklahoma. Let's talk about
Hmm.
that. What do you think, and why? So my first question is, while you were applying for Oklahoma, what do you think is one of the most important part while you're applying for Oklahoma? Like, what are they looking for in their candidates?
I applied Oklahoma before the COVID pandemic, so the bench test was really common. So I made sure that I was really strong in bench, and I didn't blink or be scared of that. So I went to Duggan's course, and that was a very good thing I did. And then also Oklahoma, I think they had a form of like a MCQ question scenario or something
Right. Yep.
regarding RPDs or something like removables. If somebody who has taken the part two recently, they would do that. And what else? Personal interview. You have to really charm them, and you know that better. You have to sell yourself.
Yep. Yeah, that's one of the most important thing is you need to present yourself in the most professional manner so you come out to
Hmm.
be a good candidate for the school. That's very important. So, okay, the question is, so you got accepted to Oklahoma, you got accepted to Harvard. So when you were applying to Harvard, what was few of the things that were really important as compared to other schools?
For me, I was picking my school based on tuition. I really didn't want to pay a lot, so I was looking at good tuition, good school, at the same time, something closer to me that my moving would be easy. But again, these are individual factors. You have to know what you're looking for.
So this is quite a professional thought process, and most DDS candidates don't realize that the amount of tuition loan we take or the amount of fee we pay is an
Mhm.
important part of our future freedom. And I think that's quite wise to think it from that perspective as well, especially since you were already doing clinical stuff in United States, so you have seen a lot of it. So what other one other part is, if I'm applying to Harvard or I got an interview and I know they only have 6 or 7 seats, what factors should I look into, or should be what things should I be presenting or focusing on while I'm giving the interview for Harvard?
So I think this is not just Howard. This is very general question. It is for every school that you interview. It's more like you have to know yourself, and you have to be very self-aware and be aware of your surroundings, and really, just be yourself. Don't pretend to be somebody else in the interviews. Don't be a reader who's just trying to memorize answers and trying to remember. No, just be yourself, be your most calm self. Interviews are always both ways. Just talk to them like you're talking to a burrito. Where's at the cafe?
So right now you're studying in Harvard. So how do you think it is as a school? Because most men, like usually they have 6 or 7 seats, so not many people have an exposure of that school. I know it's in DC. I used to live in nearby that area. serves a lot of African American community up there. But what's your overall experience from this school?
Well, the school is great, and like I always say, a person who really wants to learn can learn in any place. So we have students who have like done so much clinical, including myself. Like I've done quite a lot. I wouldn't say that a lot. It's lowered for everybody nowadays because of the COVID pandemic and everything going on. But it's still, I'm glad, I'm grateful that I did do a lot of procedures that I had not done before.
Like
Um,
what?
uh, I was able to do like implant overdentures and things like that.
Which ones? Sorry.
Implant overdentures,
Oh, nice. Implant over dentures. Yes. Okay.
yeah, implant supported, so which was nice. And things like, you know, we have good faculty for like everything, and if you really want to learn, you will learn in any place regardless. That's what I think.
I totally agree with you, and this is something that one of the things you mentioned when, and other people too, like somebody who wants to learn will learn anywhere. So yeah, we do want to apply to many school and have the option to go anywhere, but we as students need to know that if you're supposed to, you should have the capabilities to learn anywhere you go in life. But one other aspect is, if any Middle Eastern student or any student who studied in Middle East, one of the really important factor that I hear from her resume or experience is that having 6 years of schooling provides you much more clinical exposure, even during your dental
Mhm.
school. And I think that kind of gives you an edge. While I was talking to a couple of candidates from Middle East, I told them you have an edge because you did more schooling than most of other people, because in Pakistan, India, the BDS is 4 years and then 1 year of house job. So I think that gives an edge. And if you're somebody applying from these countries, I think that's a potential strength in your application and capitalize on it. So, Dr. Vora, overall, except for, I know you had a lot of clinical exposure, then you
Mhm.
did dental assisting, then you had the opportunity to work on a limited license, and obviously, exposure in that setup, you learn to communicate and everything. But what other part, except that most people don't know, would you suggest? Present yourself good, do clinical work, that's you mentioned that, but do you think there's anything else that you will suggest or that help you during your application?
I think even the way that in the first cycle that I applied, I was very haphazard with the CAPIT application itself. I think it has a proper way that you really need to arrange it, and you really need to be neat and, you know, put bullets and things like that to make it look presentable again, you know.
Yeah,
So I
that's
think that's
that's that's I think you suggested me that, like, when you're filling your capid application, don't make it haphazard, keep it organized, like you're filling in your experience, anything, make sure it's in bullet point, because people who are reading like 800, 500 applications, so you want to make it look presentable and appealing to
yeah,
the human brain.
and also symmetrical, you know, so everything goes together well.
And that's an important point for professional matters. If you're making a resume, people try to write a lot, like make it very crowded, and it looks like you're watching bees on a piece of paper. And making it symmetrical and aesthetically pleasing that the other person might give it a couple of minutes to read is very, very important. And I totally agree with these points, and most probably I learned some of them from you. But in the last, I would say, I'm impressed. You have a lot of clinical exposure in United States, more than other DDS students. When you're working with the students, does that give you a leverage, a sense of competition? How does that work with you?
I think it's good. It's in the beginning, it was difficult for me because, you know, I'm slowing down my pace a lot. Instead of seeing like, you know, 10, 12 patients a day, I'm only seeing one or two. So I'm slowing down my pace a lot. It took me some time to really slow down, but I think it's great learning both ways. I'm learning patience at the same time as, you know, they're learning something from me. So I think it's building me character
Makes
building.
sense.
Hmm.
Makes sense. But thanks for sharing this information. So before we finish this interview, any suggestion to somebody you believe is coming from a similar background that you're coming? And just imagine if you were talking to yourself about 4 or 5 years ago who's starting the process, what kind of advice would you give yourself?
I would just say that, really have faith in yourself. Don't ever give up. Really have faith and keep searching, keep looking, talk to people from Facebook group. Like, interactions you learn by interacting through different people and their experience. So really talk to a lot of people and be open about it, and really do your best.
So just to summarize, because the connection I think broke in between, but what you're saying is, if I'm correct me if I'm wrong, that uh, have faith, be consistent and determined, but along with that, have the flexibility to communicate to other people,
Hmm.
gain more information, have the knowledge of how things are going about in the universe. And I totally
Yeah.
agree. The Facebook groups and other WhatsApp group are really helpful. And one other thing I would suggest people is that people will only help you when you ask in the right way. That is one of the
Hmm.
most important thing, because most of us get a lot of questions, people ask them, and
Yeah.
there would be somebody who's pushing you with their question, who's like demanding answer me this, and you're like, I don't have time. But on the other hand, you have somebody who requests you in a manner that you are forced to
Hmm.
help them, and that is a
Yeah.
very important thing I would like to share with candidates who are applying. But thank you
Yeah.
for your time, Dr. Vora, and I appreciate it's been a long while since I wanted to get this interview done, because you're
Thank
one of the
you.
few people who got into AGD, who worked on a limited license and who got into DDS at two different places. So thank you for sharing your experience, and I hope people find it beneficial and meaningful. Well, hopefully we'll see you in a more meaningful video. And if
Thank you so
somebody
much.
wants to ask you question, what would be a good way on a social media or any way to find you if they want to ask you some questions?
Yeah, yeah, I guess you can find me on Facebook.
Okay, so it's Ikra Bora, and you can find her on the Facebook if you have any questions. I hope I'm not sending a lot of people to your profile now. But thank you for your time, and we'll talk to
Yeah.
you soon. Take care.
Thank you. Thank you. Bye.